Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and here's my roundup of the week's activities across dentistry. So I'll start with an issue that's going to be close to the hearts of those of you who've been trying to practice in the heat this week. Many of you have been asking us about the guidance on air conditioners and their impact on air circulation. So we've checked with the Health and Safety Executive, and the guidelines state that the risk of air conditioning spreading coronavirus in the workplace is extremely low. So you can continue using most types of air conditioning systems as normal. Although if you use centralised ventilator systems that remove and recirculate the air to different rooms, it's recommended that you turn off recirculation and use a fresh air supply. Sandra White from Public Health England confirmed in a webinar this week that the advice applies during aerosol generating procedures as well as non-AGPs. And fans are fine as well, another point that you've been raising with us. And there's an awful lot more detail on the HSE website, which we will link to below. Also, in our toolkit, we offer advice on general ventilation, which is obviously equally important right now, so that's also linked to below. Fallow time has rapidly become a major concern for dentists who have or are in the process of returning to work. As you know, fallow time refers to the length of time when the surgery room is not used to allow the aerosol to settle after an aerosol generating procedure, and the current guidance is for that to be 60 minutes. However, there isn't a lot of evidence either way to explain the effectiveness of the 60-minute time period. Many other countries have either no fallow time for AGPs or a shorter period, and the impact of 60 minutes is obviously very significant in terms of the number of patients a practice can see and therefore on business viability. So we're continuing to raise the issue with government agencies and with Public Health England in particular. We know there's a piece of rapid research being undertaken in dental settings, and we're due to see the results of that in early July. There's also work being carried out by the Scottish Dental Clinical Effectiveness Programme, or SDCEP, pulling together major dental stakeholders, looking at AGPs and fallow time in particular, and we're involved in that work alongside other bodies who have produced guidance such as the Faculty of General Dental Practice. Also involved in a roundtable piece of work led by the Office of the Chief Dental Officer in England, looking at what happens with AGPs, personal protective equipment and infection control as the risk from the virus reduces. As the national threat level, currently at level 3, reduces, there will be collaborative work to produce a future single piece of guidance to avoid the potential for confusion and misunderstanding, and we'll update you on that work as things develop. Yesterday we gave evidence to the Northern Ireland Assembly Health Committee on the future of dental services in Northern Ireland. Dental practices are set to move to non-urgent care later this month in Northern Ireland. However, it's likely to be at a fraction of their pre-pandemic capacity. Practices are severely limited by PPE costs and shortages, social distancing requirements and decontamination guidelines. Caroline Lappin, Tristan Kelso and Richard Graham put forward an excellent case that without adequate and ongoing support from government, it is impossible to sustain a model based on activity when activity has fallen through the floor. They called for dental services to be prioritised in the rebuilding of health services. We'll be meeting with the Health Minister to continue that conversation next week, and we will update you on progress. Meanwhile, you can watch Caroline, Tristan and Richard's presentation to the Assembly Committee via the link below. The red alert in Wales was lifted on Monday of this week, which corresponds to the easing of restrictions across the country. Dental practices are now able to provide more care and treatment for patients as long as they remain compliant with all safety and social distancing requirements. Dental practices which are ready can treat more patients ahead of the previously planned date of the 1st of July. Also this week we met with the CDO for Wales, Colette Bridgman, to discuss the proposed NHS dental pandemic recovery plans. We're discussing in particular how this will work within the context of the NHS contract in Wales. The Welsh General Dental Practice Committee is putting together some helpful FAQs on this topic, which will be available soon, so look out for those. The Scottish Government announced on Wednesday that dental practices in Scotland may be able to move to phase 3 of reopening from the 13th of July. This will involve practices beginning to see registered patients for non-AGP routine care. In response to that, we met with the Chief Dental Officer, Tom Ferris, and the Scottish Government yesterday to discuss the essential aspects of the plan, including PPE supply, practice arrangements and the funding package. CDO and Scottish Government are working on all these areas, and we plan to meet with them again next week to discuss further. Finally, as we've been saying for some time, genuinely hoping now that next week we will have some clarification on the long outstanding issue of the abatement for contract values in England. We've been continuing to make the case that the abatement should be fair and appropriate. Fingers crossed that we will be able to share something with you next week. We're also discussing what the contractual arrangements in England will be for the current return to work phase, and we may have more news on that shortly. In the meantime, please do have a safe and healthy weekend, and I'll be back next week with more news and updates.